The world of corporate America was shaken to its core on December 4, 2024. Brian Thompson, the CEO of United Healthcare, was tragically gunned down. The incident occurred outside the New York Hilton Midtown. Thompson was in Manhattan for an investor conference hosted by United Health Group. His death sent shockwaves through the industry. Thompson was known for his leadership. He had been at the helm since 2021. His tenure was marked by successes and controversies. The news sparked immediate questions and speculation. Authorities launched a full-scale investigation. The FBI joined forces with the NYPD. Investigators sought to uncover any potential motives. The assassination served as a stark reminder of vulnerability. It ignited a national conversation about security and corporate responsibility. The morning of December 4th began like any other in bustling Midtown Manhattan. Unaware of the tragedy about to unfold, people went about their daily routines. At approximately 7:45 a.m., Brian Thompson emerged from the New York Hilton Midtown. He was on his way to address the eager investors gathered inside. As Thompson walked along the crowded sidewalk, a lone gunman approached him. The assailant, concealed in the throng of pedestrians, fired multiple shots at close range. Thompson was struck in the chest and collapsed to the ground. The sound of gunshots pierced the morning air, sending shockwaves through the crowd. Chaos ensued as people screamed and scattered for safety. Witnesses described a scene of panic and confusion. The gunman, taking advantage of the pandemonium, melted into the crowd and disappeared. Despite the swift response of first responders, Thompson succumbed to his injuries. He was pronounced dead at Mount Sinai Hospital, a short distance from the scene of the shooting. The news of his death spread rapidly, sending shockwaves through the city and beyond. In the immediate aftermath of the assassination, the NYPD launched a massive manhunt for the perpetrator. Surveillance footage from the area surrounding the New York Hilton Midtown became crucial to the investigation. Grainy images captured the suspect's movements before and after the shooting. The suspect was described as a male in his late 20s or early 30s, of average height and build. He was last seen wearing a dark-colored hoodie, jeans, and a baseball cap pulled low over his face. The footage showed him fleeing the scene on foot, heading east on 53rd Street. Despite the clarity of the footage, the suspect's identity remained a mystery. Facial recognition software proved inconclusive, as the suspect's face was partially obscured. The NYPD released the images to the public, hoping that someone would come forward with information. The lack of a clear suspect in the days following the assassination only heightened the sense of unease. The audacity of the crime, committed in broad daylight in one of the most heavily surveilled cities in the world, left many wondering how such a thing could happen. Unraveling the evidence. As the investigation into Brian Thompson's assassination progressed, detectives meticulously pieced together the evidence. The crime scene outside the New York Hilton Midtown yielded several crucial clues. Ballistics experts recovered 6 shell casings from a 9mm handgun. The casings were sent to the NYPD crime lab for analysis. Forensic technicians discovered that the markings on the casings were consistent with a Glock 17 pistol. However, there was no serial number on the casings, indicating the gun was likely stolen or obtained illegally. Inside the hotel, investigators reviewed hours of security footage. They discovered the suspect entered the hotel through a side entrance 30 minutes before the shooting. He then proceeded to the lobby, blending in with guests and staff. The footage showed the suspect leaving the hotel through the same side entrance just minutes before the shooting. This suggested he had planned his escape route in advance. Searching for a motive. The assassination of Brian Thompson sent shockwaves through the healthcare industry and beyond. As investigators worked tirelessly to track down the killer, attention turned to the question of motive. Why would someone target the CEO of one of the nation's largest health insurers? Thompson's role at United Healthcare made him a powerful figure in an industry often criticized for its high costs and complex bureaucracy. Some speculated that the assassination could be linked to disgruntled patients or healthcare providers unhappy with the company's policies. Others pointed to Thompson's personal life, suggesting that the motive might lie in a personal grudge or vendetta. However, those close to Thompson described him as a devoted family man and a respected member of his community. They found it difficult to believe that anyone would want to harm him. As days turned into weeks, the investigation into Brian Thompson's assassination continued. The lack of a clear motive only deepened the mystery surrounding the case. The question of who wanted Brian Thompson dead and why remained unanswered.